Kia ora. So we're here today at the National Rural Health Conference. I have with me today Kyle Eggleton. Hi, Kyle.
Hi.
Now, Kyle, you come from up north, are you?
Yeah. So I'm a Northland bred and raised GP. So I grew up in a little place called Waima in the Hokianga. I spent my childhood there, and then my family comes from the Hokianga. We date back kind of many generations to Northland.
And now you work there?
I've been working in Northland for the last about 15, 16 years or so. Last 8 years I've been working as a rural GP for a Māori health provider called Kia ora Ngāti Wai.
Neat, okay. And you did a very interesting talk today, very, very opening, very inspiring. I think you captured quite a lot of the audience. You touched on health inequalities in the community.
Yeah.
And you sort of broke it down into 3 or 4 main parts.
Yep,
Yeah.
so 4 main parts. I kind of talked about how it's important to look at how we engage with communities and what we can do as rural practitioners about empowering communities more. And for me that means communities starting to take control of healthcare and hopefully kind of governing healthcare more as well.
Yeah, and I like that because that's kind of the way that we should be moving healthcare, shouldn't we? We've gone from kind of like a behavioural change, kind of top-down approach to this empowering approach where you get the community, the bottom-up approach to make the changes, and they're finding that that's kind of making more of a change than what we've been doing in the past, isn't it?
Yeah. So as GPs, we have been trained in this health education model, and health education is not an empowering sort of thing. We're just imparting knowledge to people. So many people have talked about how if we're going to really empower people, people have to actually come up with the problems and the solutions themselves, and that creates long-lasting, long-standing change.
Yeah, I can see some sort of implications with that a little bit, is that fact that the community has to come up with it, so that can take a bit of time. Yeah, whereas being in a GP practice yourself, it's so easy to just sort of part that knowledge over, and so it's kind of quite a challenging thing, but something that needs to be necessarily done.
Absolutely. Yeah. It's really, really hard to do that, and especially if you constrain the time. How do you go about empowering an individual? It's not an easy answer.
No, it's not. Okay. All right. Well, let's talk a bit about the talk. You talked about aunties, which is the part I quite liked. Tell me a bit more about the aunties.
Yeah. So we have aunties that kind of they're what we did was we had a hui in one of our community centres, and the people in the hui said that they would really like to kind of take a bit more control because they didn't really like the way in which the kind of the service was run. So they came up with the idea of having a number of aunties or kuia at the front desk, and they would kind of take the role of a receptionist. So we don't actually have receptionists.
You don't have a receptionist?
No, we don't have a receptionist, not in that community centre. And so it's the aunties that run the show. Okay. And they kind of like start picking up on things that are going wrong with the community and starting to help us solve problems in the community as well.
Okay. So they kind of look after the patients?
Yeah, that's right. They're supposed to nurture the patients.
Oh, neat.
Yeah, so
that's cool. Okay. And the second part where you talk about the role of the practice. Can you talk a bit more about that?
Yeah, so one of my things is I think that practices need to change the culture. And that means kind of having a culture which reflects the community that they're sitting in. And that one of the first people at that front desk, the receptionist, is such a vital part to kind of like reflecting what the culture of the practice. That means having that person who, as I said, what the aunties do is kind of look after people. So if you do have a receptionist, the receptionist should be kind of nurturing and welcoming and trying to advocate on behalf of patients.
And not the scary dragon
that
everyone's scared of.
Yeah.
Cool. And the third part of your talk, which I remember you teaching me at university, was the hui process. You got the mihi, then the whakawhanangatanga, and then the kaupapa part, and then the purupuru-aki. Is that right?
Yeah.
How do you do that?
When medical students start doing it, it can be quite awkward. So I've got a medical student, had a number of medical students recently, and they feel really embarrassed and shy about doing it, and it doesn't seem natural to them. But after you do it, after a while, it just becomes an integral part of your consultation. Sometimes with the whakawhanangatanga, it's not something I kind of like start off with sometimes it happens as the consultation evolves.
Yeah, it's kind of, if you liken it to an everyday effect, it's kind of like how we sit in the taxi and talk about the weather.
Yeah, that's right.
It's kind of the commonality that you find, isn't it?
Yeah, so we're moving away from these really structured medical consultations to something that's more of just a consultation between two people, just a conversation more than the consultation.
And the idea is that you get engagement, rapport, trust.
That's right.
Yeah, that's cool. Cool. And the last thing you talked about was unconscious bias, which was quite an eye-opener. I thought it's not something that we do every day or even think about really. That's why you call it unconscious, I guess. But
yes.
yeah, do you want to just touch on that?
Yeah, so unconscious bias is the idea that we all have implicit kind of values and ideas that shape the way in which we think and act. And often these things, kind of the pattern recognition type of things, happen really quickly within our brain. And if we can reflect on our own biases, then it means that we can actually challenge those biases over time. It's very hard to get rid of them, they're unconscious, but we can reflect and try and change things.
Yeah. And do you mind giving what would be an example of an unconscious bias?
Yeah, so an example might be that you assume that someone's not going to take a medication because they're a particular ethnicity.
Yeah.
And that would be an example.
Yeah. That's good. Thank you so much for coming along today, Kyle.
Oh, thank you.
It was a great talk. Yeah, I'm sad that people got to miss that. Yeah, very eye-opening, very enlightening, and very self-reflecting.
Thank you.
Cool. Thank you.